We've struggled with out of stock of medicines and consumables, but we've put processes in place to ensure that we're able to overcome some of these challenges. One of the important things to remember is that all medicines and consumables that we use in the hospital are bought from overseas. We don't manufacture any in Fiji. In fact, we've organized for a session for the media for you guys to have go to FBS and have a look at some of the processes that we follow. Because we are reliant on our overseas providers and suppliers. We are also reliant on the supply chain processes, not only locally but overseas as well, to be able to get all these medicines that we need and supplies that we need in a timely manner. So it's quite a challenging process, and that's something that we are working with the Ministry of Finance and the Fiji Procurement Office to try and see how we can overcome some of these challenges. This is to implement a new inventory management system, and it's called M-Supply. The inventory management system, the new inventory management system, has now been rolled out I think just last December, has rolled out to all our health facilities, and that inventory management system has allowed our health facilities to use the information system to order for supplies and also update their stock that they have with themselves. But it also allows us to be able to redeploy supplies from one facility that may have a surplus to a facility that has lower. So that system is in place, and that is starting to show an impact in terms of improving our out of stock of medicines and supplies. We're not completely, over it yet. But I think with continuing use of the system, we'll be able to improve the system, but also improve the status of availability of medicines and supplies at our various health facilities. And I think in the session that we've arranged for the journalists and reporters, you'll be able to get to see how that system works and how it has have an impact on our health facilities at the front line. Yes, so the M-Supply also covers reagents for testing, and includes reagents that we use particularly for the laboratory. And we've had situations where we've had low in stock of reagents, and we've been able to respond to that through the use of the M-Supply. And you also know that for testing, we also have relationships or agreements with private providers. And so even when we don't have reagents and ability to test in our public hospitals, that agreement allows us to quickly take out our specimen to our private providers so that they can fill the gap while we are getting our reagent supplies back. So that's been the process or the arrangement that's in place. It's allowed us to fill gaps when reagents are not available. But certainly the ideal arrangement would be for us to be able to have our own supplies of reagent and do our own testing. So when we don't have reagents, we are not able to test. So the arrangement that we have is for the same tests that are available in the private sector, we take the specimen out so that there is no gap in terms of the decision making for the treating doctor. So if it's cannot be done in the public sector, it is quickly taken to the private sector, and we get the results so that the decision making and the treatment plan for the patient continues.
Is this what has been happening recently?
Yes, we've used that over the years as a sort of a stopgap measure when we don't have the ability in the public sector, and that's what the agreement that we currently have allows us to do.